you about cataract surgery and its recent advances. Before I start, I must tell you what is a cataract. As you all know that inside the eye, there is a natural crystalline lens which focuses image onto the retina. If you talk about the refractive surfaces of the eye, the light first falls on the cornea, which is the first refractive surface. Then it falls onto your crystalline lens and then onto the retina. That's how the refractive status of the light falling on the eye is defined, and they join to a point on the retina whereby we see the images. Any opacity in the crystalline lens is called cataract. As you all know that most of the cataracts, they occur at old age. They are called senile cataracts. But cataracts can develop as early as just a newborn child, when it is called a congenital cataract. It can start even in an infantile cataract in the younger age. Juvenile cataracts, even at a little later stage before you develop into adulthood. So at different stages, cataract is possible. Most commonly, the cataract that we are talking about is a senile cataract developing in old age of say 50, 60, 70 or 80. So friends, let's understand. And also besides, it's very important to know that some of the cataracts can be induced by ourselves. That means using a steroid orally or in the form of drops. Diabetes and certain other illnesses can give rise to cataract. So let's talk about what is the option if one gets cataract. There are some important surgeries. One of them, now no more done except in certain circumstances, is extracapsular cataract surgery with lens implantation, where advanced techniques are not available. And it was the technique with which we started putting lens inside the eye, in which stitches are done after the end of the surgery. Then is SICS, small incision cataract surgery, where advanced machines are not available, but incision of 5 mm to 6 mm is made, through which a lens can be implanted, and also the cataract can be removed with a special technique. And this method can give rise to little higher astigmatism, that is more cylindrical power. It is suitable in centers where sophisticated phaco machines are not available, and also in certain conditions where the cataract is too hard or too much hypermature. Then in those conditions SICS may be employed. Now we talk about the most common procedure of phacoemulsification. In this phacoemulsification, which can be also modified as MICS, microincision. Microincision phacoemulsification is a surgery in which incision size is 2 mm or less. Through this incision, we do the cataract surgery. We all know that in the procedure, we first make a capsular access. That means incise the anterior capsule of the eye, and then we remove the cataract by phacoemulsification. In phacoemulsification, we use the ultrasound energy to break the lens into different fragments and to eat up these fragments so that the entire lens is eaten up. And then, with the help of suction and aspiration, we remove the cortical matter and only a bag of lens capsule remains, where the posterior capsule is intact and the anterior capsule, you have an opening. Now we put an artificial lens inside the eye, and that lens could be foldable lens which can pass through 2 mm incision or less than 2 mm incision, or even 2.5, 2.8 mm incision can be employed for different other types of lenses. These are foldable lenses. Non-foldable lenses also can be implanted where the incision size has to be a little bigger. So MICS nowadays is the most practiced technique in phacoemulsification, in which a very small lens, foldable, soft foldable intraocular lens is put inside the eye, which unfolds in the anterior chamber, then it's in the capsular bag, it's placed and it remains there. Now, the newer and the latest technique is FLACS, or femtosecond assisted cataract surgery. What is this femtosecond laser? We all know that cataract surgery has advanced to a great extent. Now we can make the incision for entering the cornea through the femtosecond laser. We can do capsular access through femtosecond laser. Then we can emulsify. In fact, we can break the lens into different segments and different shapes depending on different type of programs in the femtosecond laser, so that most of the work in phacoemulsification surgery can be done with femtosecond laser. After that, the pieces can be removed in a usual phacoemulsification technique. The advantage of FLACS is that it is highly accurate, results are highly predictable, quality of vision is improved because incisions are very, very precise. So astigmatism and the lens induced surgeon's astigmatism is also reduced. So quality of vision can be expected to be better. However, in the hands of an experienced phacosurgeon, you may have identical results in a FLACS or a MICS. Also, there are lens position, there are a lot of other things which are very important. They also can be managed well in FLACS. Friends, nowadays, what is the most important revolutionary change in cataract surgery? The change is, now cataract surgery is not only a simple surgery to get rid of glasses, to get rid of cataracts, but it's also become a refractive surgery option. That means you can get rid of glasses permanently. In fact, in younger individuals, you have often seen the LASIK being done to get rid of glasses, and SMILE also technique which is practiced. Now all these patients who are old, they have been using thick glasses, myopic glasses or hypermetropic glasses and presbyopic glasses when they were aging above 40. They have a good news that they can be without glasses. They can manage their life, their activities after the cataract surgery. So it's a bonanza after the cataract surgery that they can get the benefit of refractive surgery. How is this achieved? We have special lenses. We all know that the most practiced lens after a phacoemulsification procedure for cataract is a monocular lens. That means it corrects one powder. And more often than not, it is the distance power which we normally correct. Sometimes, depending on individual need, we may go for a power which will help the person for near work or intermediate work, depending on his condition or his requirement. Good monofocal lenses are available. However, there are multifocal lenses available which provide vision not only for distance glasses but also for reading segment. Earlier in monofocal lenses, if distance vision you can see very well, but for reading you have to have the additional glasses. But in multifocal, this can be removed to a great extent. The problem is dysphotopsia, which is a troubling point, and a neural adaptation. Adaptation by the patient, some can adapt, some cannot, and there can be problems. And photopsia is the most problematic thing. That means you see halos and glare. And that is why there is advent of another lens, and that is known as trifocal lenses, which are remarkable in their ability to correct for distance, intermediate and near vision, and also the chance of glare and halos are reduced to a great extent. So they are the lenses of choice. The other lenses which are popularly used these days are extended depth of focus lenses. The good thing is that they provide the clarity and good vision, distant vision of monofocal lenses. At the same time, they offer some advantage of intermediate vision so that patients dependent on glasses is reduced. They are very important. Now there is another kind of lens called toric lens which can be incorporated in a monofocal lens or in a extended depth focus lens or even in a trifocal lens. This is a great remarkable feature in modern cataract surgery because earlier cylindrical power couldn't be corrected and the cylindrical correction had to be given. Now with the toric advantage, you can correct astigmatism cylindrical power. Sometimes you can't guarantee a person that you will be totally spectacle free after cataract surgery. Maybe 60% patients may not require glasses at all, but 40% may require a little bit power. Then came a solution of light adjusted IOLs. There is a special in 2017 FDA approved lenses have come into force. They allow the power to be modified after the surgery. That means after second or third week of surgery, with the help of special light adaptable devices, you can alter the power maybe up to 4 times so that whatever the refractive status that remains, that can be adjusted and the refractive error can be eliminated even after surgery. That is very important in certain type of conditions where you have a refractive surgery done earlier or in complex situations where there is a corneal transplants or you are not able to get corrected refractive power, so that this device that is the light adjustable IOL can be a good answer. And once the power is adjusted, you can lock in that power so that no more change is done and no more change is required. But till the time this is done, you have to wear especially ultraviolet protected glasses because there can be some variations, some problems if you don't wear them during that period till the final lock-in of power is done. So friends, modern cataract refractive surgery has tremendously done a wonderful job in modern ophthalmology and modern sciences, and we can say that cataract surgery today is one of the most predictable surgery with the finest results of all the surgeries anywhere in the body. And modern ophthalmology has given such a bonanza to the cataract patient. Now they get a gift after the cataract surgery of remaining spectacle free. That is a great achievement and a milestone. Thank you very much for a patient hearing.